Hi everyone, my name is Aparna Sivaraman, and today I will be presenting on COVID-19 telemedicine from a provider's perspective. So just to introduce myself, I'm Aparna Sivaraman, my pronouns are she, her, hers, and I go to Rockbridge High School in Columbia, Missouri, where I am a rising senior. I hold active leadership roles in Science Olympiad, Science Bowl, host of Future Health Professionals, and varsity girls tennis. My favorite topics at school would probably be chemistry, math, and emergency medicine, and in the future, I'm interested in becoming a pediatrician in psychiatry or sports medicine. So first, before I get into the research, I think it's important to review what has happened the last year and a half with COVID-19. So in January of 2020, an unknown virus was found in Wuhan, China, and a case that had this virus was found in Washington state from someone who had traveled to Wuhan recently. In March of 2020, the virus spread rapidly throughout the world. In the United States, the Grand Princess cruise ship was found to have several cases and was docked outside of San Francisco. There was also a mass shortage in personal protective equipment at this time. In March through April of 2020, the world shuts down. Countries sealed their borders, and in the United States, guidelines were placed so that people were in quarantine and had to start wearing masks and social distancing. In May and June of 2020, the world slowly opened up again, and while case rates were lower at the beginning, they soon skyrocketed again. Researchers needed to find some sort of cure or vaccine to help. In July through November of 2020, people struggled with unemployment, mental health issues, and getting back into the new normal. In December of 2020, the FDA authorized 2 new vaccines, but people were worried that the new variants of the virus would make this vaccine less impactful. In 2021, there are now 3 approved vaccines, and vaccines are starting to get pushed out to the communities. States have lifted some of their mask mandates, social distancing policies, and made quarantine rules less strict. So first, I'd like to overview the research that I did. So at the start of quarantine, I became interested in COVID-19 research and making some sort of impact while being stuck at home. So I developed a list of 10 questions about telemedicine and provider satisfaction. I worked with 2 doctors at the University of Missouri Columbia, Dr. Raghunath and Dr. Malhotra, to send out a mass survey to attendings. 1,039 were emailed and 249 complete responses were sent back. We performed statistical analysis on these results and published an article in the Telemedicine Reports Journal titled COVID-19 Pandemic as Catalyst for Telemedicine Adoption, a Single Center Experience. So for some context, the survey results were collected between April and May of 2020, which was kind of the start of the pandemic when people were in quarantine and not many people were able to go out. Many rules for healthcare practices at this time were not very strict because of audio, video, and radio communications that were being used to have patient and provider interactions. HIPAA-related paperwork, certifications, and trainings were also halted or simplified because of the pandemic. So first, just to go over the sample and the validity of the survey, physicians, fellows, residents, and mid-level providers were surveyed in this study, and responses were voluntary as said in the email sent out to these providers. Anonymous responses were collected via Qualtrics software, and the survey questions were analyzed and approved by the IRB and the University of Missouri Columbia, which is the Institutional Review Board. So why is this important, you may ask? Well, COVID-19 is a global pandemic after all, so it has affected the whole world, and it's important to learn about the opinions of providers and those working firsthand with patients during this time because they are the ones directly making an impact on these patients. Telemedicine use at this time also increased significantly, so it's important that we learn about how this was positively or negatively impacting medicine. So the results of this survey, most respondents were attending physicians, 177 specifically, that were new to telehealth. 78.3% of these physicians were highly satisfied with telemedicine. 85.1% wanted to continue to use some sort of telemedicine in the future, and based on chi-squared analysis, there was no significant difference found between the satisfaction of males versus females and surgical versus non-surgical specialties. So this is one figure from the actual paper. In this survey, as said before, 10 close-ended questions were used and asked during the survey. So 3 of the questions are shown in this graph. The questions were, currently, what percentage of your day involves seeing patients via telemedicine? What percentage of your telemedicine visits include both audio and video? And what percentage of your future medical practice would be via telemedicine? 101 providers said that 0 to 25% of their day involved telemedicine use. 44.6% of respondents used video and audio in their telemedicine visits 76 to 100% of the time. 138 of the respondents claimed that 0 to 25% of their future medical practice would be in telemedicine. So this is another figure from the paper. The graph shows the breakdown of satisfaction in using telemedicine. Majority of respondents were somewhat satisfied or extremely satisfied with their telemedicine practices. The graph also breaks down to show the provider's use of telemedicine, with blue bars showing people who use telemedicine less than 50% of the time, and orange bars showing people that use telemedicine more than 50% of the time. And lastly, this is another figure from the paper, and it's a bar graph that shows the breakdown of different specialties that responded to the survey. Majority of responses, as exemplified by orthopedics, surgery, and neurology, show that future practice will predictably use telemedicine 0 to 50% of the time. So, concluding based on these results, telemedicine was being used through all subspecialties at very high rates, and returning patient rates were higher than new patient rates. And additionally, the use of both video and audio communication was high, showing a necessity and growth of these technologies in order to improve these communications. Particular specialties, however, did struggle to use telemedicine because of their need for stronger technology, like ophthalmology, as you cannot perform certain tests and get certain diagnoses just through video and audio communication. Telemedicine will continue to play an important role in health and will most likely be implemented into residency and fellowship trainings in case something like this were to happen again. So here are my references. And I just wanted to give a special thanks to Dr. Hariharan Raghunath, who works in critical care medicine and infectious disease, and Dr. Kunal Malhotra, who works in nephrology and in internal medicine, both from the University of Missouri, Columbia. So thank you for watching. If you have any questions or comments, feel free to email me at the email listed or contact me on any other media platforms. I have also included a QR code to the journal publication in case you are interested in reading the whole article. Thank you so much.